Hello, thank you for your interest in treating your patients with PrecisionFlex resistance rods. I'm Dr. Kyle Shanaville. I'm a board-certified specialist in orthopedic physical therapy and manual therapy. I specialize in outpatient orthopedics, and I've been treating patients for over 15 years. This is part one of a three-part series which will cover the upper extremity. Before we begin, let's briefly discuss return on investment. I've been utilizing PrecisionFlex with my patients for about over 2 years. When the intent of the exercise is to increase strength, you can utilize the therapeutic exercise CPT code. But what's great and unique about the PrecisionFlex resistance rods is that you can also utilize them to increase dynamic joint stability, proprioceptive and kinesthetic awareness. Therefore, you can also utilize the neuromuscular re-education code. So I typically charge both these codes with my patients in addition to the charges with the other treatments that I provided. So let's begin the demonstration with some of the most effective treatments for the upper extremity. One of the most common exercises that I use for the upper extremity is to strengthen the serratus anterior muscle. So what I do is I put the rod against the wall at shoulder level. I'll make sure that the elbow is extended fully the whole time, and then we're going to concentrate on shoulder protraction. So we'll go forward. Typically I'll hold about 3 to 5 seconds and then back. The tendency sometimes is the patient will want to bend the elbow, and that's going to work more the tricep. So if I'm concentrating for serratus anterior, I want to make sure we keep that straight. So forward and then back. You can increase using a different level as they progress. And that's the serratus anterior. The next exercise is elbow curls. You can place the rod in front of your shoulder, grab the other end of the rod, and bring it towards your shoulder. Nice and slow and controlled. Elbow curls. For the next exercise, we're going to do external rotation of the shoulder. It's best on this exercise to put the rod either in the door frame or in the corner for increased stability. So you place the end of the rod against the door frame, or again, you can put it in the corner. Elbow at the side, and you're going to externally rotate the shoulder towards the other end of the rod. You can adjust the resistance a little bit. If you need more, you can step in, or again, increase by a new level of rod. That's external rotation of the shoulder. One quick way you could do internal rotation of the shoulder is just to go ahead and grab the end of the rod and work the opposite direction. So you just grab the end of the rod, have your elbow at your side, and just bring towards that end of the rod to work internal rotation. Again, nice and slow and controlled movements are important. To work the pectoralis muscles, grab the end of the rods, have your arms above your head, elbows bent about 90 degrees, and then rotate the ends of the rods as they touch each other. Nice, slow, and controlled movements. Another good exercise to work your pec muscles as well as your shoulder adductors is to grab both ends of the rod and then bring your elbows down towards your sides. Your elbows will start at 90 degrees, and again at the same time they'll go down to your sides at 0 degrees. Another exercise I commonly will use is the P&F diagonal technique. The involved arm is going to bring down towards the uninvolved arm. Nice, slow, and controlled. And you can progress with the different levels with the rods. Then you can work D1, bringing the uninvolved arm up, and the involved side is going to go towards that arm. Again, nice, slow, and controlled. You can assist the patients with this as you're working with them, and then they can work independently after that, just kind of giving them verbal cueing. So that's diagonal D1 pattern. To work the shoulder depressors, put the rod on the floor, go ahead and bend the rod, keep the elbow fully extended, and then push the shoulder down towards the floor, making sure that you do not bend the elbow. If you wanted to work the triceps, you could actively bend the elbow. But in this particular exercise, we'll keep it fully extended to work the shoulder depressors. That concludes part 1 of a 3-part series of utilization of PrecisionFlex resistance rods. Part 2 will be coming soon.